Assalamu alaikum dear doctors. In this video I am discussing about osteomyelitis. So, osteomyelitis is an infection of the bone marrow which may spread to the bone cortex and periosteum via the Haversian canals. It can be categorized as acute hematogenous secondary to contagious local infection with or without the presence of vascular disease or direct inoculation from trauma or any surgery. Most common site of infection, the distal femur and the proximal tibia in children. Remember, the distal femur and the proximal tibia in children. There is cancellous bone in adults, commonly in vertebra or feet. However, ultimately any bone may be affected. When dead bone become detached from healthy bone, it is known as sequestration. A large sequestrum that remains in situ acts as a focus for ongoing infection. Causative organism, that is Staphylococcus aureus, is by far the most common. In about 5% of cases, more than one organism may be involved: Pseudomonas, E. coli, Streptococci and fungi. Risk factors. Risk factors of osteomyelitis is that diabetes. Always look for osteomyelitis in diabetic feet and deep pressure sores. Vascular disease, impaired immunity, sickle cell disease, surgical prosthesis and open fractures. Features: pain of gradual onset and unwillingness to move. Local findings include tenderness, warmth, erythema and slight effusion in neighboring joints. Investigations is that elevated inflammatory markers ESR, CRP increase and elevated WBC count. Blood culture showing most useful in hematogenous spread of infections, positive in 60% of cases. Bone biopsy and culture gold standard. Imaging is that MRI is the imaging modality of choice for investigation of acute osteomyelitis. Plain X-ray films may be helpful in the diagnosis of chronic osteomyelitis, but its use is limited in acute cases. Management. Antibiotics, that is flucloxacillin for 6 weeks in acute cases and for 12 weeks in chronic. Adding fusidic acid or rifampicin for initial 2 weeks. If penicillin allergic, then clindamycin. For MRSA, vancomycin. Surgical debridement and analgesia. Complications is septic arthritis, fractures, deformity, chronic osteomyelitis. Always suspect in vascular insufficiency with non-healing tissue ulceration overlying bony prominence. There is a question come on AKP exam that a mother known heterogeneous sickle cell brought her 5-month-old baby with a 3-day history of leg pain, history of falling from sofa and become more irritated during nappy change. In electrophoresis, baby is homogeneous and positive neonatal screening, has upper respiratory tract infection 2 days before, snuffle nose, temperature 38. What is the diagnosis? So here all the features is supporting the diagnosis is osteomyelitis. This is all about osteomyelitis. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.